I'd like to call on Professor Aiko Tanaka from Yamaguchi University in Japan to deliver her presentation. Creation of online nursing ethics courses utilizing the principles of PBL learning.
Hello, my name is Aiko Tanaka. I am a professor at Yamaguchi University in Japan and specialize in nurse education. I would like, first of all, to thank the organizers for holding this symposium. Today, I'm going to talk about a model online course using PBL, which our team is working on as a research project. This project was funded by HARA Newcastle PBL Education and Research Center's academic research project this year. We would like to thank you again for the support. This is our project team members. We are a multidisciplinary nursing team from Yamaguchi University, Japan, and Professor Stone, a professor of special mission at Yamaguchi University, currently in Australia due to COVID-19, and Professor Conway from UNE Australia. We also have great support from Ms. Maeda and academic staff of our faculty. In Japan, with many students choosing to go on to college, there has been a paradigm shift from a lecture-centered education to student-centered learning, and active learning is becoming widespread. Since the publication of the report by Ministry of Health, Labour and Welfare on contents and methods of nursing education in 2011, active learning have been emphasized, not only the practice training, but also in the lectures for students to learn the thinking process of nursing. From the year 2022 onwards, the nursing curriculum is scheduled to be revised nationally to meet the need of the society, and active learning initiatives, including PBL, are required, especially in nursing universities. The number of articles on active learning using PBL has recently been increased, and it is about 10 articles per year. Like other universities across the world, nursing academics in Japan were required to immediately implement online learning in response to the coronavirus pandemic. The use of web-based learning in nursing education in Japan has been limited, and academics and students are largely unfamiliar with this mode of teaching in Japan. Web-based learning has been used for a demonstration of clinical skills via video or as a part of research supervision. Our team at Yamaguchi came together to explore the most effective way to implement online teaching and to learn and develop effective pedagogies for online teaching. With the involvement of Australian colleagues, this study will explore the process of developing an online course using the principles of problem-based learning, which requires active student engagement in groups as they explore content related to ethical situations in nursing in Japan. The purpose of this exploratory study is to capture the experiences of nursing faculty in the process of creating nursing ethics online lecture content for the master's levels through an action research process. Participatory action research will be used as a framework of our research because it explicitly seeks to bring about change and improvement. It can be characterized as a bottom-up quality enhancement process, concentrating issues of interest or concern relating to the delivery of online learning and assessment of the nursing academics. We developed the content of the Nursing Ethics online course based on the ITDEM process. The content of this online course was developed separately from the existing master student course. The course was planned to run for 1.5 hours per week for 4 times. It was conducted using PBL approaches. We planned to include in the course ethics principles, exploration of clinical scenarios, and critical thinking using ethical frameworks, and some contents from several different areas of nursing. Many of our postgraduate students at Yamaguchi University are nursing staff who have more than 3 years of clinical experience and are working in clinical settings. This study targeted nursing faculty and clinical nurses, public health nurses with at least 3 years of clinical experience, and a total of 12 people indicate a willingness to participate in this course. This is demographic characteristic of participants. All participants are female. Average of clinical experience were 10.1 years. Average of educational experience were 7.1 years. Experience of receiving nursing ethics education were 25%, and online education were 41.7%. This is the outline of the project. In this study, action researchers who are nursing faculty members in Japan and Australia created an online nursing ethics course utilizing problem-based learning. The created course was conducted with the participants, and after the course, all the participant experience, including the researchers, were described through the implementation and evaluation reflection of the nursing ethics. The objectives for students at the end of the course are shown on the slide. For example, demonstrate application of ethical principles to cases drawn from their own practice, or demonstrate effective communication with other participants. A total of 2 case studies were presented on day 1 and 2 by the researchers, and participants made discussion. Day 3 and 4 were designed to use PBL to study the ethical issue that the students were facing in their daily practice. The reflection template is shown on the slide. Using this template, participants and faculty members reflected after each meeting and online class. The cases were used in shown on the slide. This is a case in which Hanako wanted to take care of other residents in the facility, but unfortunately caused an injury. In the end, it was concluded that Hanako should not move around at night by herself, and she was given sleeping pills to ensure she and other residents were safe when staffing was lower at night. We wanted to clarify the ethical issues involved in this case. Before considering the case, we asked the participants what they would like to know other information. We also asked why they want to know that. Before considering the case, we asked the participants what other information they would like to know. We also asked why they wanted to know that. These were the issues generated from the case study. In case study 2, we considered Hanako's situation some years later. This was a scene where Hanako, who was unable to eat, and a decision has to be made about whether or not to insert a gastrostomy to feed her. Hanako was now in a situation where she could not convey her thought to others. However, in the past, she said she didn't want to prolong her life by 2. These scenarios allowed us to discuss ethics in a detailed and relevant way. We have not yet begun data analysis. This will be challenging due to the amount we have collected. PBL style, watching the process of the participants, discovering and solving problems. At first, some academic members found it very difficult to sit back and watch the process. But little by little, changes has been appeared. We look forward to analyzing all the data and reporting back on the experience. Thank you so much for taking the time to join today.
PBL method in the nursing ethics course through your presentation. I expect to complete the rest of the project and find it in the journal soon.